Tuberculosis. Definition: a contagious bacterial infection that mainly affects the lungs and is caused by Mycobacterium tuberculosis. Causes: inhalation of airborne droplet from a person with active TB. Effects: persistent cough, chest pain, fever, night sweats, weight loss, and fatigue. Medicine and treatment: combination therapy of isoniazid, rifampicin, pyrazinamide, and ethambutol for 6 months. Disease number 2, pneumonia. Definition: inflammation of the ear 6 alveoli is one or both lungs, often filled with fluid or pus. Causes: bacterial, Streptococcus pneumonia, viral or fungal infection. Effects: cough with phlegm, fever, chills, shortness or breath, and chest pain. Medicine and treatment: antibiotics, amoxicillin, azithromycin, rest or fluids, antiviral if viral cause. Disease number 3, asthma. Definition: a chronic inflammatory disease of the airway causing narrowing and difficulty in breathing. Causes: allergens, dust, smoke, cool air, and respiratory infections. Effects: wheezing, breathlessness, coughing, and chest tightness. Medicine and treatment: inhaled bronchodilator and corticosteroids. Disease number 4, chronic bronchitis. Definition: long-term inflammation of the bronchi leading to excessive mucus production. Causes: smoking, air pollution, or repeated respiratory infections. Effects: persistent cough with sputum, fatigue, and shortness of breath. Medicine and treatment: bronchodilator, corticosteroid, and quieting smoking. Disease number 5, emphysema. Definition: a chronic lung condition where alveoli are damaged, reducing oxygen exchange. Causes: long-term smoking or exposure to air pollutions. Effects: shortness of breath, chronic cough, and fatigue. Medicine and treatment: bronchodilator, oxygen therapy, and pulmonary rehabilitation. Disease number 6, COVID-19, coronavirus disease 2019. Definition: a viral respiratory disease caused by SARS-CoV-2. Causes: transmission through respiratory droplet from infected individuals. Effects: fever, cough, fatigue, loss of smell, and breathing difficulty. Medicine and treatment: antiviral, rest, oxygen therapy, and vaccination prevention. Disease number 7, influenza, flu. Definition: a contagious viral infection affecting the nose, throat, and lungs. Causes: influenza A or B virus infection. Effects: fever, chills, sore throat, muscle aches, and cough. Medicine and treatment: antiviral drugs, fluids, and rest. Disease number 8, whooping cough, pertussis. Definition: a bacterial infection causing severe coughing fits and a whooping sound. Causes: Bordetella pertussis bacteria. Effects: uncontrollable coughing, vomiting after coughing and fatigue. Medicine and treatment. Antibiotics, azithromycin and DTaP vaccination for prevention. Disease number 9, bronchiectasis. Definition: permanent widening and damage of bronchi leading to mucus accumulation. Causes: repeated infection, cystic fibrosis, or obstruction. Effects: chronic cough, thick sputum, and lung infections. Medicine and treatment. Antibiotics, chest physiotherapy, and bronchodilators. Disease number 10, chronic obstructive pulmonary disease, COPD. Definition: a progressive lung disease that obstructs airflow and makes breathing difficult. Causes: long-term exposure to smoke, dust, or chemicals. Effects: shortness of breath, chronic cough, and frequent infections. Medicine and treatment: bronchodilator, steroids, oxygen therapy, and smoking cessations. Disease number 11, pulmonary fibrosis. Definition: a chronic lung disease that causes scarring fibrosis or lung tissue leading to breathing difficulty. Causes: long-term exposure to toxins, certain medications, radiation therapy, or idiopathic unknown origin. Effects: dry cough, shortness of breath, fatigue, and chest discomfort. Medicine and treatment: antifibrotic drugs, oxygen therapy, and lung transplantation in severe cases. Disease number 12, pulmonary hypertension. Definition: a condition characterized by high blood pressure in the arteries of the lungs. Causes: heart disease, chronic lung disease, blood clots, or unknown idiopathic causes. Effects: shortness of breath, dizziness, fatigue, chest pain, and swelling of legs. Medicine and treatment: vasodilator, diuretic, oxygen therapy, and anticoagulants. Disease number 13, pulmonary embolism. Definition: a blockage in one of the pulmonary arteries in the lungs, usually caused by a blood clot. Causes: blood clots from deep vein thrombosis traveling to the lungs. Effects: sudden shortness of breath, chest pain, rapid heartbeat, and low oxygen levels. Medicine and treatment: anticoagulants, heparin, warfarin, and clot dissolving drugs. Disease number 14, sarcoidosis. Definition: an inflammatory disease that causes a small lumps to form in the lungs and other organs. Causes: unknown, possibly due to abnormal immune response or environmental triggers. Effects: dry cough, fatigue, shortness of breath, and chest pain. Medicine and treatment: corticosteroid and immune suppressive therapy. Disease number 15, pneumothorax, collapsed lung. Definition: a condition in which air leaks into the space between the lung and chest wall, causing lung collapse. Causes: chest injury, lung disease, or sudden pressure changes. Effects: sharp chest pain, shortness of breath, and rapid heart rate. Medicine and treatment: needle aspiration, chest tube insertion, or surgery in recurrent cases. Disease number 16, pleural effusion. Definition: a buildup of excess fluid between the layers of the pleura outside the lungs. Causes: heart failure, pneumonia, tuberculosis or cancer. Effects: chest pain, cough, and shortness of breath. Medicine and treatment: thoracentesis, fluid removal, and treating the underlying cause. Disease number 17, silicosis. Definition: a lung disease caused by inhaling fine silica dust over a long period. Causes: occupational exposure to silica dust, mining, sandblasting, construction. Effects: cough, shortness of breath, and lung scarring. Medicine and treatment: avoiding exposure, bronchodilators, corticosteroid, and oxygen therapy. Disease number 18, asbestosis. Definition: a chronic lung disease caused by inhaling asbestos fibers. Causes: long-term exposure to asbestos and construction or insulation work. Effects: shortness of breath, chest tightness, and dry cough. Medicine and treatment: no cure. Management includes oxygen therapy, pulmonary rehabilitation, and avoiding asbestos exposure. Disease number 19, lung cancer. Definition: a malignant tumor that forms in the tissue of the lungs. Causes: smoking, secondhand smoke, air pollution, or exposure to asbestos. Effects: chronic cough, coughing of blood, weight loss, and chest pain. Medicine and treatment: surgery, chemotherapy, radiotherapy, and targeted drug therapy. Disease number 20, sleep apnea. Definition: a sleep disorder in which breathing repeatedly stops and starts during sleep. Causes: obesity, airway obstruction, or neurological problems. Effects: snoring, daytime sleepiness, and poor concentration. Medicine and treatment: continuous positive airway pressure, machine, weight loss, and oral devices. Disease number 21, pleurisy. Definition: inflammation of the pleura, the double-layered membrane surrounding the lung and chest cavity. Causes: viral or bacterial infection, pulmonary embolism, or autoimmune diseases. Effects: sharp chest pain, the worsens during breathing or coughing, shortness of breath. Medicine and treatment: anti-inflammatory drugs, ibuprofen, antibiotics, and rest. Disease number 22, pulmonary edema. Definition: a condition in which a fluid accumulates in the lungs or sacs, making it difficult to breathe. Causes: heart failure, pneumonia, high altitude, or toxins. Effects: shortness of breath, coughing up frothy sputum, anxiety, and sweating. Medicine and treatment: diuretics, oxygen therapy, and treating underlying heart disease. Disease number 23, respiratory syncytial virus RSV infection. Definition: a viral infection that affects the lung and airway, common in infants and older adults. Causes: RSV virus spread by droplet when an infected person coughs or sneezes. Effects: cough, runny nose, wheezing, and breathing difficulty. Medicine and treatment: supportive care, oxygen and antiviral drug, ribavirin in severe cases. Disease number 24, occupational lung disease. Definition: a group of lung disorder caused by long-term exposure to harmful substances at work. Causes: inhalation of dust, fumes, asbestos, or chemicals. Effects: chronic cough, shortness of breath, and chest tightness. Medicine and treatment: avoid exposure, bronchodilators, and corticosteroids.